day, my name is Maria Isabella S. Cruz from BS Nursing, and I will present to you what and how the medical asepsis is. But first of all, medical asepsis is also known as clean technique. It protects both the client and the caregivers from becoming ill, and also the patient. Healthcare facilities of infection control policies and procedure which must follow in an attempt to control the spread of infections. The first thing you will do is hand washing. Of course, this is the simplest yet most effective infection control that can prevent and controls the transmission of infection agents. It is the rubbing together of all the surfaces like this. But of course, there is an essential element of hand washing. First thing is soap. Of course, anything liquid bar or liquid soap. Second is water and lime. Lastly, the friction, which is the most important element, of course, when you rub your hands. So let's go to the sink and I will show you how the hand washing procedure is. I'll be doing the hand washing procedures. So the first step is to prepare the equipment needed. As you can see, I prepared the dry cloth, the tissue, and I'll be using the liquid soap there because preparing the needed equipment, it saves energy and time. So the second step is to remove the jewelry. As you can see, I don't have any jewelry right now. I'll be continuing to the third step is to assess hands for hangnails, cuts or breaks into the skin. I don't have any as I can see. So now we will turn on the water and adjust the flow. So it says hands are the most considered contaminated than the arms. So water should flow from the least contaminated. Here, the hands to the most contaminated area to the skin. So we will be using the in and out method, not the like this, the backward method. Water should flow from the least contaminated to the most. I'll be doing the steps. Apply about 5 mm or equivalent to 1 teaspoon of liquid soap. Microorganisms are suspended in the latter. Facilitates removal of microorganism liquid soap. Our herbivores less microorganism than bars. The water is away dirt and microorganisms from the least contaminated to the most contaminated area. I'll be doing again the in and out. Cloth hands and forearms to dry thoroughly using cloth. I'll be using the cloth. First step. Clothing reduces chopping of skin, drying from cleanless fingers to the skin area. Another side, to prevent transfer of microorganisms to the cleanest areas. Like that. So, my hands are already dry. I'll be using now the tissue to turn off the water. Clean hands by a contaminated faucet and dirty hands were used in turning on the faucet. So I use the tissue method. We all know that all healthcare providers will supply clean or sterile gloves, gowns, masks, and protective eyewear such as the face shield. Clean or disposable gowns or plastic gowns are worn during procedure when there is possibility that the uniform of the nurse is likely to become soiled. The purpose of this gowning is to protect the person and the uniform of those who come in contact with the client from contamination. And the equipment needed are surgical gloves, cap, masks, face shield of course, and the gown. So we are done with the hand washing procedure. Now let's continue to the donning of the clean gown. The first step you will do is to pick up the clean gown and allow the gown to unfold in front of you without allowing it to touch any soiled or contaminated area. This is to prevent contamination. Slide your arms and hands through the sleeves. Put your hands or you go through the fasten the ties at the neck and to the neck so the gown keeps in place. Now, overlap the gown on the back as much as possible and tie waist or belt. Waist ties or belt keep the gown from falling. Now we will proceed to the gloving. The purpose of this is to protect the hands when the nurse is likely to handle any body substances such as blood, urine, mucous membranes, and non-intact skin. And it also reduces the possibility that the hands of the caregiver will transmit microorganisms or the bacteria from one client to another client. The first thing is to place the wrapper on the clean surface because if not, any moisture on the surface will contaminate the gloves. Identify the right and left hands. Always remember that the dominant hand will come first. This is my dominant hand. Dominant hand facilitates motor dexterity. Now gently pull the glove over the dominant hand, making sure that the thumb and fingers fit into proper spaces of the gloves. And always remember sterile to sterile and unsterile to unsterile. It prevents tearing or tearing the glove's material. With the glove dominant hand, slip the fingers under the cuff of the glove. Make sure it does not touch any part of the non-dominant hand. Now gently slip the gloved hand onto the needle's dominant hand. And the contact is made with the two sterile gloves. The gloved hands interlock the fingers to fit the glove onto each finger. It promotes proper fit of the fingernails. Now we will wear face mask and face shield as they are worn to reduce the risk of transmission of microorganisms transferred through the droplet contact and airborne through and by splattering of body substances. The purpose of this is to filter inspired and expired air and provides a barrier from the pathogens one may inhale or exhale. The purpose of this face shield is to protect the eyes from the body substances that may splatter on the face of the nurse. So this is the full PPE. Moving on the feet. First untie the belt to the ends and allow them to turn down. Then the neck. And fasten the tie to the neck. So avoid touching the solid parts of the gown to prevent contamination. Place the first two fingers of hand under the bottom part of the gown. Remove your face shield. Gently remove the face mask and don't touch the outer part so it prevents the top part of the mask from falling into the chest and hand contact with the moist and contaminated portion of the mask. Discard the disposable face mask in the appropriate receptacle to lessen the transmission of any bacteria. Now, the client remains free of any nosocomial infection. The healthcare providers and the staff are protected from infection and microorganisms are contained without cross-contamination.